In the myeloproliferative neoplasm session at SOHO, we had two presentations by Dr. Radek Skoda. Dr. Skoda was talking about how does the MPN disease happens and what are the parameters that we know that contribute to existence of the disease. These are two different events. You may have actually a JAK2 mutation present in the normal person, and it is present in 0.2% of the people older than 65, without any disease. So genetic abnormalities can be detected without the disease. I repeat, because this is something that we don't usually hear. There must be something in the host, in the person, that would allow the disease to happen. And that's the key. It is not one factor. It is environment in the bone marrow, some other abnormalities, either genetic or not genetic, that would lead to those bad cells to start to grow, proliferate, and be recognized as a disease itself. We actually know that in a way because the diagnostic process for PV or ET or myelofibrosis does not depend on the isolation or identification only of the mutation, like a JAK2 mutation or MPL or colorectal mutation. You need to have other parameters, anemia, fibrosis, big spleen, and other factors. So it is contributing to the diagnostic process. But perhaps it was not recognized that the disease to exist has to include a number of different biological parameters to exist. And now, how does it progress? That was another point of a discussion Dr. Skoda was taking about fibrotic transformation of the disease and the acute myeloid leukemia transformation. So in the second talk on the transformation from the indolent, relatively benign essential thrombocythemia or ET or PV to myelofibrosis and then to acute myeloid leukemia, Dr. Skoda was talking about contributing factors, again, in genetic landscape or epigenetic landscape or in bone marrow environment, with different cell compartments contributing to existence or production of the fibers that worsen the bone marrow failure, lead to anemia, thrombocytopenia, and shorten the life expectancy. Fibrotic transformation actually is the most enigmatic event in the life of the patients with myeloproliferative neoplasm. We don't really understand why does it happen. Much more focus is on the transformation to acute myeloid leukemia, where we understand the genetic complexity that leads to it, and we try to intervene by interfering with certain genetic abnormalities with new medications, like IDH inhibitors or EZH2 inhibitors and others. This is because the transformation to acute myeloid leukemia is much more serious and deadly. But to stop that process, the whole process, we would be benefiting much more if we could intervene with the fibrotic transformation, which is the hot topic for discussion, and Dr. Skoda was trying to explain it to the degree possible.